My name is Lexi Zuliger. I'm a 25-year-old physical therapy student, and this is my chronic pain story. My journey with chronic pain began in the winter of 2009 when I was studying at home. I was a typical 15-year-old junior high student whose backpack was way too heavy to be on my shoulders. One night I decided to move all of my things to my room, so I swung my backpack on my shoulder. However, it was lighter than I anticipated. So instead of it landing so nicely on my shoulder, it ran into my neck. It hit what I would later be told was my C3 vertebrae. And along with that came a weird popping sound and some weird feelings, including numbness and tingling in my hand, my feet, and my tongue, oddly enough. When my mom came home, my face was still numb, and I decided to tell her what happened. We went to the doctor the next day and was given a prescription for physical therapy, Vicodin, and muscle relaxants. I ended up only taking the muscle relaxant because the pharmacist said that a 15-year-old should not be taking a heavy narcotic and a muscle relaxant. When I went to physical therapy, my neck pain was slightly relieved, but my physical therapist kept asking if I was at that 0 out of 10 pain that she wanted me to be at. I wasn't. I was discharged from physical therapy with exercises and a 1 out of 10 pain at the best. My pain continued to persist, but I learned to function with it. A year later, I was in gym class, and we were doing an exercise during a circuit routine that involved throwing a medicine ball forward and landing in a modified push-up position. When I was doing this, I knocked my shoulder blades together. Now, sitting right there, I want you to try to knock your shoulder blades together. Just have them touch. It's not really possible, but it happened. So, I ended up with 2 bone bruises, 1 on each shoulder blade, and really bad back pain in the middle of my back. My mom decided to bring me to a chiropractor in the hopes that she could help with my back pain and my persistent neck pain. I went to the chiropractor at least once a week for about a year and a half until one day my appointment was cut a little short. He was able to adjust me from my neck all the way to my toes in about 5 minutes. He was running behind because he had a lot of new patients that day. I didn't think anything of it besides the fact that I felt a little off. So I went home and I laid down on the bed like I was told to do for 20 minutes. When I woke up the next day, I couldn't move my back. I could only move my spine as a single unit. I moved like that for about 2 days, and then my mom called the chiropractor, and they said that I had ruined my realignment and that I needed to go back for an appointment every day for a week. I went to 5 appointments in a row with no real relief in pain, and then I decided I was done with the chiropractor because I was afraid he would hurt me again. After all this had happened, I started to develop numbness and tingling in my hands, particularly my right hand. And I also would wake up in the morning with decreased sensation and sometimes the feeling of paralysis in my right arm. Both of these gave my mom and I concern, and we decided to go to my primary care physician. She stated that this was probably just some athletic pain and that I would be better with physical therapy. So I went to a different physical therapist who was very patient and willing to work with me in all of the issues that I had developed over the years in my back. I kept having to go because I wouldn't give up dance and martial arts like I was told to do by several doctors. I was persistent in being active, which led to sacrificing my neck and back pain according to several physicians. One day we went back to my primary care physician for another issue, and my mom brought up my pain again. My doctor said it's still probably just growing pains or athletic pain since she's not giving up any of her activities. My mom had asked, what about chronic pain? We hear that that's a thing. And the physician told me that I was too young to have chronic pain. Only older adults can develop chronic pain. So So I was left with no answers as to why I still was ever unable to reach that 0 out of 10 pain. It was always a 1 or higher. I was able to manage the pain with the help of my physical therapist and all the exercises they gave me. And it was going pretty well until I moved to college. When I went to college, my pain got exponentially worse. I have a feeling this is because my backpack got heavier and I didn't have a place to set it down for the entire day. I had to carry it on my back between classes. At the same time, I started to develop a condition where I would just randomly pass out due to different triggers. I later learned one of these triggers was pain. So my mom and I went to another primary care physician and I told her my entire story. She had said that it sounded like I was experiencing chronic pain. My mom and I both said, but I'm only 19. We were told that that wasn't possible for me to have. And my physician told me that that is not the case. You can have chronic pain. And that I should go to physical therapy to see if I can fix it, or at least help it. So with my mom's excellent research skills, we found the Physicians Spine and Neck Clinic that specialized in the spine and neck and had physicians and physical therapists involved very heavily in patient care. Upon my first appointment, they did a strength test and told me that my spine muscles had atrophied due to misuse and due to the pain, and that my back actually was exhibiting signs of an 85-year-old woman with osteoarthritis. That's right. On my first appointment, I was told my back was about as good as an 85-year-old woman's back with osteoarthritis, and I was 19. So I worked really hard, I did all of their strengthening, and I felt a little bit better. But I still wasn't at that 0 out of 10 pain. They discharged me because I made great strength gains, and I was actually at around average of a 19, 20-year-old woman. And I felt okay, but not better. About a year later, I started to have migraines. And so I went back to my primary care physician and she ordered an MRI. The MRI came back with some weird findings, so she recommended I go see a neurologist. The neurologist then sent me for another MRI of my cervical spine to see what was going on. I had found out a little bit later that I had developed bone spurs in my C3, C4 vertebrae, and I was diagnosed with osteoarthritis from a traumatic incident. The traumatic incident was my backpack hitting my neck 6 years prior. At the age of 21, I finally had an answer and I was told I wasn't crazy. That it was normal for me to not be at a 0 out of 10 pain, but rather at a 1 or 2 on my good days. It took me 6 years to find an answer for my pain. It took me 5 years to find a doctor who would listen to my pain and would confirm that it wasn't normal and would say that it wasn't just me growing or me experiencing athletic injuries. To this day, my best pain day is a 1 out of 10. As of right now, while I'm recording this video, I'm having a pain day of about 4 out of 10. I am still able to function. I am able to treat patients in the clinic and make it look like I'm totally fine. Because I decided when I was 15 years old to not let my pain define me. However, I will tell you that I felt great relief and comfort in the fact of the diagnosis of osteoarthritis because I didn't feel crazy anymore. I went to a physical therapist who decided to take that diagnosis of chronic pain and osteoarthritis and educate me and give me proper treatments on how to best manage my pain. I'm doing better now, and my pain is well under control and managed. It just took a physician and a physical therapist to finally listen and to use the proper education and treatment to get me to this point.